Well, opioids are the mainstay of our practice. People have pain. Opioids are the drugs that treat pain. Unfortunately, opioids have a lot of side effects, have a lot of addictive capabilities, and because of that, patients can get into trouble taking narcotics. It's very difficult to stay on chronic narcotics for years. Hence, patients that are started on them, if it's not for a short period, and if the goal is that they're going to have long-term care with opioids, it's very difficult for them not, at some point, to take too much, at some point to have some family member find it in their closet and take it, at some point lose their medications. And with all the restrictions that are now in place, which are good restrictions to keep the use of the narcotics and the opioids safe, it's just becoming more difficult for patients that need opioids to get their opioids. We try to lean our patients away from the use of opioids. Opioids are sort of the drug of last resort. So if we're able to treat them some other way, most pain states in general are reversible. If we can find the source of the pain, treat that source, either through injections, either through surgeries, or other means, then the patient won't need the opioids. Opioids are wonderful for short term. They're wonderful as a bridge gap, as a Band-Aid, to be able to try to get patients' pain under control. But it really should be a long-term answer. The use of a narcotic or an opioid for the long term really should be looked at and scrutinized to see if there's something that can be done. Specifically, is there a surgery? Do you have a herniated disc in your back? Is that sciatica that's bothering you, that you've been taking a pill, 2-3 pills a day for a long term? Is there another way? An epidural steroid injection, some increased activity, or surgery on it to try to get it under control. So using other techniques so that patients don't have to stay on the opioids is sort of the goal of our practice. Without question. And I can say that easily because the word addiction means if you stop taking the medication, you're going to be craving it. That happens all the time with opioids, and that's what really is causing a problem with people. People become addicted even if they need the medication, because the stopping of it abruptly will cause issues with them. So by virtue of the use of these long-term, people will get addicted to the narcotics. We have an addiction specialist in our practice also. So someone that is taking the narcotics for the wrong reason, which is the more general term for an addict. Everyone's going to be addicted to them psychologically and physically because they need them. Just like you can be addicted to insulin if you're diabetic, just like you're addicted to high blood pressure medications if you have hypertension. But the person that's taking them inappropriately, we can monitor these people. We can offer them other ways of being able to get their opioids, specifically long-acting opioids. There are many medications on the market now that can be used instead of the short-acting medications. People usually get in trouble, if they are going to get into trouble, with the short-acting medications. They'll get a surgical procedure, they'll get a dental procedure, and be given short-acting narcotics. They then say, okay, one's working, why don't I try 2 to see if that's better, and all of a sudden they're taking a lot of pills. By switching someone that needs to take these chronically over to a long-acting narcotic, the use of the short-acting one goes away. The patients are getting their pain relief, and we can keep them away from the short-acting ones, which are more problematic for most people. We're talking about a very small percentage, but if you multiply that by how many surgeries, how many dental procedures, so even 1% of 1 million procedures is still going to be people that are going to get into trouble with this. And it really, those are the people that are taking them inappropriately. There are large groups of people that can't live their lives without opioids. And to take that away from them, to say, okay, stay home, don't do anything, don't function, that's not really fair to these people. So getting in trouble with the opioids versus using the opioids to increase their function. So one of the things as a chronic pain provider that you absolutely need to do is you're sort of looking at pain relief, but more importantly, you're looking at functional status. So if the person's taking the narcotics, but they're going to work every day, if the patient's taking the narcotics and they're able to function, do all the things that they want to do, then that's the appropriate use of the medication. If they're taking it just to sit on the couch and drool, it's the inappropriate use of the medication. So obviously we need to figure that out, and we do have tools. As I said, the use of addiction psychologists is another way to root out people that are going to have trouble with these.